Please welcome Brie Jackson back to the stage, joined in conversation by Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation.
Dr. Besser, thank you for being here. It's a pleasure to see you in person. I've seen you on TV quite often, so thank you for being here.
Well, thanks for having me. I'm looking forward to the conversation.
Well, so the government is shut down in large part because of this issue of healthcare. And as a doctor, and someone that oversees the largest private foundation that's devoted solely to improving the nation's health, I know there may be a lot of them right now, but what are your biggest concerns?
Wow. That is a tough question. You know, since day one of the administration, we have seen an all-out assault on people's ability to lead their healthiest life. So this latest chapter with the shutdown and discussions around subsidies for the Affordable Care Act is a very small part of what's taking place. If you look at the actions of the administration, firing of thousands of health workers, the reconciliation bill, which has led or will be leading to millions of people losing health insurance, millions of people losing food supports. These are critical factors for people and their ability to lead their healthiest life. Listening to the senator, people want to have a relationship with a doctor. We are moving towards a situation where tens of millions of people won't have that opportunity. And what that does is it shifts the cost of care to medical institutions that may not be able to support that. You know, one of the big concerns about the reconciliation bill and the big cuts to Medicaid is the strain that's going to put on rural healthcare in particular. Rural hospitals depend for a large part on Medicaid dollars to stay open. And it is a challenging situation. And so any cut to Medicaid will put a strain on those hospitals. And you know, I'm part of the Aspen Health Strategy Group. It's a bipartisan group, and we focused on rural healthcare this year. And one of the things that was really stressed is that when a rural community loses its hospital or its clinic, you don't only lose the opportunity to have healthcare nearby, you no longer are attractive for business to come in. No business wants to move into a rural community if there's not healthcare available. So it is a really complicated issue, but it's a big issue in terms of economic development. And if you look at the biggest drivers of health for people, it's income. So if you're losing jobs, you're losing your healthcare, you are creating a situation where health, just the aspect of leading a healthy life, becomes out of reach for millions and millions of people.
And you touched on this, but you mentioned the firing of health workers. We've also known that some health departments have been cut. And I guess in all of this that's happening, which communities do you feel may be suffering the most from all of these cuts?
Yeah, you know, I worked at the CDC for 13 years. And I also worked in federally qualified health centers as a general pediatrician for more than 30 years. And so the game of who's going to be hurt the most strikes me as, you know, the wrong game to be playing. Public health is practically invisible when it's working. But when it's not working, and the system is stressed with a new outbreak, with a water system that is making people sick, it becomes very, very visible. And public health is one of the great levelers in our society. It's one of those things that helps ensure that everyone has the opportunity to lead a healthy life. So whether you're talking about vaccinations and making them available for free to all children in America, or you're talking about having a public health system that makes sure the food you eat is safe, the water you drink is safe. Public health is that equalizer. And the CDC, the vast majority of the budget that comes to the CDC is passed through to state, local, tribal, territorial health departments. So these billions of dollars that were pulled back are going to affect health in all communities, and you're going to see that. You saw it very early. Milwaukee was dealing with a problem with lead poisoning in the water, and they called CDC to get support, and the department that focused on lead poisoning was gone. It was one of those departments that was cut early on by Secretary Kennedy. Those things, you only see it when they're stressed, but if you're in a community and you can't drink the water, you feel it.
And speaking of Secretary Kennedy, you've been a vocal critic of Secretary Kennedy, and in a letter with 8 other former CDC directors, I'm going to use your words in this letter, that you accused Secretary RFK Jr. of endangering every American's health by dismantling established scientific norms. In your view, what are the most immediate risks posed by these leadership changes?
Yeah, the idea that we have as a Secretary of Health, one of the nation's leading anti-vaccine advocates, is absolutely frightening. As a general pediatrician, I spend a lot of time talking to parents about vaccinations and answering questions, the pros, the cons, those issues. But when you have a Secretary of Health who is so anti-vaccine, who clearly has come in with a very strong agenda to make it harder and harder for parents to do the right thing for their children, to do what they want, and that's protect their children from preventable diseases. It's absolutely frightening. I mean, it's hard to pick one action that he's taken. The firing of the advisory committee to the CDC that makes recommendations around vaccination. This was a committee of experts that included the various medical societies that take care of patients around the country, experts in infectious diseases, experts in epidemiology and vaccine science, fired them and replaced the committee with largely anti-vaccine advocates. And so to watch the committee hearings and see them try and come up with recommendations, it was really disturbing. And so, as a pediatrician, I'm not practicing now, but if I were, I would not look to the CDC anymore. And the CDC was really the world's crown jewel when it came to a public health agency. And unfortunately, that's not the case anymore. There's terrific people still working at the CDC, but its ability to do its job has been severely compromised.
And you touched on this a little bit, but we know there's a lot of medical disinformation swirling around out there, in particular around vaccines. And why is this misinformation around vaccines so crucial, so hurtful?
It's hurtful because parents want to do the right thing. And anything that the government does that undermines trust in vaccination will lead some parents who want to do the right thing by their children to, I think, make the wrong decision. The CDC doesn't mandate the vaccination of children. It makes recommendations. Those recommendations are then taken by states, and it's states, and in some places it's cities and local public health departments that set the requirements for school entry. But following the Secretary's committee hearings, you saw Florida, the Surgeon General in Florida basically say that vaccination for children going to school should be voluntary. That is a frightening thing. I've done a lot of global health work, and I've seen wards of people with polio. That's not something we want to see again in this country. And it's not fear-mongering. These diseases are under control because we vaccinate. And we vaccinate because the diseases that could come back with a fury can be devastating. And so it sows confusion for parents when you have a secretary who is spreading so much misinformation about vaccination.
Now, shifting gears a little bit, you said that you want that the Robert Wood Johnson Foundation's vision is to make health a right, not a privilege. What does that look like in practice in the context of current policy proposals around Medicare, Medicaid, mental health, and women's health?
So philanthropy is in a very privileged position. We can take a long view. And so, we are seeing policy after policy that is taking us in the wrong direction when it comes to health. It is creating more and more barriers to health. When you see the administration come in and slash the budget for the National Institutes of Health, cancel any grant that has the words diversity, equity, and inclusion in it, research to try and understand issues of maternal mortality. We were hearing a conversation around that. Why in America are Black women twice as more likely to lose a baby or to die during pregnancy? I mean, that shouldn't be. You can get to the answers with research, but if that research isn't allowed, it moves us in the wrong direction. I lost the thread.
It's a complex issue.
Yeah. So we have an administration that has a fundamentally different view on its role and the role of government in terms of people's lives and health. And when you look at philanthropy's role in this, that's where we were, philanthropy. We can stick with this for longer. And one of the things that gives me hope is that the systems that we see, a healthcare system that does not work for everybody, it's not about getting back to that. It's about creating a vision for what could be. We're the only wealthy nation in which the entire population doesn't have access to healthcare. Well, that doesn't have to be. We can create a way of getting there that is much less costly than the system that we have. We had a public health system that did not work for everybody. Well, what could it look like to have a public health system that did? And so philanthropy can work with others to create a vision that is inspiring, that motivates people to say, no, this isn't it, but here's what could be. And that's what we want to see.
What role does the private sector play in developing this equitable system?
Well, you were saying that I've been a loud voice speaking out. I've heard silence from the private sector. And I think, until we see the private sector speaking out, it's going to be very hard to move the needle. But the private sector, when you see millions of people losing their affordable care subsidies, this is going to add to the cost that the private sector bears. We're the only nation where so much of healthcare is provided through insurance that you get from your employer. Well, let's work for a system where that isn't the case. If you look at the advances in medicine and biomedical science, so much has come from the NIH, and then the private sector has moved forward with commercialization. Well, if the NIH isn't doing that, well, it's going to have to come to the private sector to build the research capacity that we've seen here in our universities and in the NIH. So I want to see private sector leaders standing up and saying, no, this isn't right. This isn't, the US should not give up its role as the leader in biomedical science. There's a lot that the private sector could be doing that it's not. And I think part of it is that each sector, one by one, has been frightened into silence. And that has got to change.
In AI, this is something that's become a part of our everyday lives. What role do you see AI playing in improving health systems?
Yeah, artificial intelligence has incredible potential for good, but it also has potential for harm. And one of the areas that we have concerns about is if you look at AI that's used for medical decision making, it's based on existing data. And if existing data has built into it bias by race, by gender, by sexual orientation, then the AI itself is going to generate biased outcomes. And that's something that we have funding that's working to address that. But you need to see the sector really embracing that in a big way. If the reason for different outcomes by race or by gender has to do with barriers to health, barriers to access to health, barriers to compliance, barriers to making it harder to come for follow-up, you may see in those data systems that the outcome by race and gender are different. But if you can address the underlying cause, differences in income, differences in outcome, you'll see those go away. And so it's very important that we don't build AI systems that entrench and solidify the structural racism and sexism that's in our healthcare system.
And we've talked about some barriers here, we've talked about challenges here, and even in talking about these tough issues, you seem to take on an optimistic tone about achieving health equity. And just where do you see the momentum in achieving that goal and moving forward with health equity?
Pediatricians by nature are optimists. And so, I come at the world from that perspective. When you see a child, or you bring a child into this world, that in and of itself is an optimistic perspective. When I see young people standing up and saying, no, there's a better way, that gives me optimism. When I hear people speaking out and saying, not only is diversity, equity, and inclusion not illegal, these are fundamentally American values. We have a nation where everyone should have the opportunity to dream and see those dreams come true. And if we can provide a vision for that, it's going to rally people, and we're going to get there. So I do see this moment as one where we need to not say, let's go back to what was, because that wasn't working for so many people in our country. We can provide a vision for something better.
And we've touched on a lot of different topics today, so thank you for going through all these topics. But for you, what's the most important message that you want to send to this room when they're walking out, when they leave today? What do you want them to remember about this conversation?
What we are seeing is a wholesale destruction of our public health system, and we cannot allow that to take place. We need our elected officials to do their job and to say this is going to harm the people who brought us into office. And we can't accept this as the new normal.
What's the call to action?
Stay informed. If you're a parent, talk to your doctor about vaccines, because we're entering the winter season, and that is a time when there's a lot of respiratory viruses going around. But find out the pros and cons and make the right decision. But if I were a parent and I were sending my kids to school, I'd want to know what the vaccine coverage rate was in my kids' classroom.
Dr. Besser, thank you for your time today.
Thank you.